perhaps we can move on to, I think, what is more your area of preference at the moment, which is joint preservation. Hannah's already asked about this. She's obviously getting fed up with me going down foxholes of my own. She wants to know when it's appropriate and what is it meant for, what's meant by it, especially in younger people.
So I will move away slightly from what I would term the sort of sequelae of young hip disorders in childhood. So, there is a subsection of what I do that's related to patients who are diagnosed in their pediatric life with either dysplasia, slipped epiphyses, perthes, or other things like that. And so if we then talk about the other mechanical problems you run into, essentially for me, they fall into two camps. One is impingement, which perhaps you hear a little bit more about, and the other is instability. And there are a variety of different causes of both of those. So as a sort of, if we're going to be stereotypical, because it kind of helps a little bit to package up patients, your impingement patient is likely to be a young male patient, usually quite sporty. I think a lot of these are problems of active individuals rather than sedentary individuals. So there'll be football players, rugby players, tennis players, whatever it might be, but they'll be quite active in general. It's generally activity-related pain, and they'll generally get discomfort at end range of motion or after periods of activity. And what you would then find as a clinician seeing them is they tend to have slight restrictions of motion. So, as you bring their hip into flexion, you lose a lot of internal rotation. That and the more extreme maneuvers are where you start to generate pain in the joints because you're impinging them. But then outside that range of motion, the hip is actually not terribly uncomfortable. And there are a number of causes, for that, which we can discuss. But the sort of instability patient is normally slightly different. So that would be classically a young female. They're often a little bit hypermobile to a greater or lesser extent. Again, they'll often be quite active, but they'll often be, dancers and gymnasts, and things like that, where the extra mobility that they have in their hips is actually a benefit, to their chosen sort of sport and activity. And they'll present in a very similar way in terms of their pain distribution. But what you'll find, again, when you examine them is not only more generalized signs of, say, hypermobility, but you'll also notice the hip maintains its range of motion a great deal better. And although they'll have more end range of motion pain, it will be, at a wider range of rotation, for example. And again, there are different causes for that. And you'll see that spectrum amongst males and females. There's huge amounts of crossover, obviously. Those are a good example of the sort of extremes of both.